diagram shows the lungs as viewed from the front. I have drawn on the oblique fissures. Where they are seen here, they lie rather inferiorly at the anterior aspect of the lung, but they course posterior-superiorly in an oblique fashion and lie much higher up posteriorly in the lung. They divide the upper lobe from the lower lobe. On the right side, I have now added the horizontal fissure, which courses horizontally. The dotted line represents the division between the left upper lobe and lingular segment. The lingular segment is the left-sided equivalent of the right middle lobe, but lying on the left. Therefore, the lungs can be considered as being anatomically symmetrical. The following diagram now shows these lobes divided so that we can talk about the bronchopulmonary segments. It's worth considering the right and left lung as being completely symmetrical, and there are 10 bronchopulmonary segments on each side, which are all numbered. However, there are 2 fused segments on the left-hand side, which we'll talk about. The upper lobes have 3 bronchopulmonary segments each. The left upper lobe has 1 fused segment, which is divided by the dotted line. One other useful tip with the bronchopulmonary segments is that their positions are named intuitively in relation to their anatomical position in the chest. On the right side, segment number 1 is the apical segment, segment number 2 is the posterior segment, because it's posterior, and segment number 3 is the anterior segment. On the left side, the apical and posterior segments are fused. So 1 and 2 is the apico-posterior segment, and segment 3 is the left anterior segment. I'm now going to follow the same system for the right middle lobe and lingular. It should be remembered that the lingular is actually anatomically part of the left upper lobe, but for the purposes of our aide-memoire, it's considered like a left middle lobe. Again, the right middle lobe and lingular can be considered to be relatively symmetrical. They both have 2 segments each. However, the right middle lobe has a lateral segment and a medial segment, 4 and 5 respectively, and the lingular segment has a superior and inferior segment, 4 and 5 respectively on the left. Finally, the lower lobes are divided into 5 segments. I think of these as being like pyramids, with a segment at the top and 4 segments at the bottom. The segment on the top on both sides is called the superior segment. The 4 segments at the bottom are the basal segments, and they're named according to their positions. So 7 on the right is the medial basal segment, 8 is the anterior basal segment, 9 is the lateral basal segment, and 10 is the posterior basal segment. The arrangement on the left is the same, but there is again a fused segment here, the anteromedial basal segment. Otherwise, the arrangement on the left is the same.